All right, this is a big week. This week, the FDA will evaluate the first COVID-19 vaccine for that emergency use authorization.
All right, in anticipation of this approval today, state and local health officials spoke about what will be happening here in this state over the next month. WMAR 2 News' Abby Isaacs tells us.
While the FDA looks at the efficacy of these vaccines, states are determining who will get the first doses. Maryland's first round won't even be enough for all frontline healthcare workers. Johns Hopkins experts believe millions of COVID-19 vaccine doses could be available by the end of the month. Maryland will get about 155,000 in the first round.
Initially, it will be about, what's the risk for health for individuals, and also with healthcare workers who are caring for those high-risk individuals.
As we get more doses, they'll also go to first responders and then move into phase 2.
Phase 2 are those critical infrastructure and essential workers, and first among those, for consideration is teachers and education. And so we know what the impact has been educationally on children.
And in preparation for more doses, Dr. Jinlene Chan says the State Department of Health is working on building a vaccine information system,
which we will use at local health departments to both schedule patients, but also then to send out reminders to bring them back. And it will all help us, track to make sure that they get not only the first dose, but the right second dose, because it has to be the same vaccine the second time around as well.
Something Baltimore City health officials are focusing on is reaching high-risk populations in the meantime, looking to trusted community partners to help with messaging.
I think it will also be very important that we're honest and transparent about what we know about the vaccine, about what we know about its efficacy, its safety, its short-term benefits, and acknowledge that there are things that we don't know.
Among the things we don't know is how long immunity lasts. But Dr. William Moss, director of the International Vaccine Access Center, is optimistic it will last a few years because the Pfizer and Moderna vaccines both require 2 doses.
It's called a prime boost strategy, where you prime the immune system and then boost the immune response with the second dose. And it's possible that that's going to confer, longer duration of protection, better protection than certainly a mild infection with COVID-19.
The FDA is meeting on Thursday to look over Pfizer's trial data, and then a week later they'll look at Moderna's. They're expected to authorize emergency use shortly after. In Baltimore, Abby Isaacs, WMAR 2 News.
And tomorrow, Governor Hogan will discuss the state's COVID-19 vaccination plan. He has a news conference set for 3 o'clock tomorrow afternoon. We will carry it live here and on all of our streaming platforms as well.